So are you suffering from menstrual irregularity, unwanted hair on your body, mood swings, weight gain, lot of acne, fatigueness? If it is so, you might be suffering from PCOS or PCOD. 1 in 10 women in India suffer from PCOS. Hello everyone, this is Dr. Pragya Gupta, practicing obstetrician and gynecologist. So let's discuss what is PCOS or what is PCOD. PCOS stands for Polycystic Ovarian Disease or Polycystic Ovarian Syndrome. Do you know 50% of the women go undiagnosed and 50% of the women with PCOS land up into diabetes, high blood pressure, going to psychiatrist, and even landing into endometrial cancer. So let us first discuss about the symptoms of PCOS. Most important and the commonest symptom of PCOS is menstrual irregularity, that is problem with your periods. If you're having delayed periods, less or scanty periods, or even heavy periods, then you might be suffering from PCOS. Most of the women suffer from delayed period problems. They get their periods in 2 months, 3 months, and sometimes they don't even get their period for a year. In some women, around 15%, the periods are very heavy, associated with passage of lot of clots. The lady has to change her pads every 2 hours. The clothing and the bed sheets are soaked completely. Along with this, the lady also gets lot of pain in her periods. Next very important symptom of PCOS is the weight issues. Lot of women, around 50%, suffer from the problem of weight loss. They are unable to lose weight even after a lot of exercise, proper diet, and even by crash diets. The lady also suffer from the problem of a lot of peripheral fat, by which I mean the fat over your lower abdomen, that is the belly area, the pelvic area, that is your hip area, and the arm area. Apart from this, and even contrast from this, there are some ladies who are very thin and lean. This is a completely different spectrum of PCOS, which is known as lean PCOS. We will be discussing about lean PCOS further in our series, but today let's discuss about some of the very common symptoms of PCOS, one of them being weight gain. In PCOS, male hormones increase, especially androgen and testosterone, because of which the male pattern hair growth increases in the body, especially on the face, the upper lip, the chest area, and the back. Even the hair are of coarser type, they are more thicker. When the women go to the parlor to get these hair removed, there's a lot of pain in removal of such hairs, and the hair are not even removed. These hairs can only be removed by proper laser treatment or by your OCP treatment, which we will be discussing in future. Because of the increased male hormones, the female not just suffers from the unwanted hair on her body, but also faces a lot of problem with pimples or acne. So these pimples are not just simple bump on your skin. They are filled with pus and are called pustules. Apart from pimples, the lady also suffers severe hair fall, which is again due to increased level of male hormone in her body. The hair fall is so much so that the woman also suffers from patchy, loss of hair on her scalp, which is known as alopecia. Not just the hair and the skin, but also the voice of the women changes into manly. The vocal cord that we have, even the structure changes and the voice gets more deeper and manly. Not just the voice, even the structure of the body becomes more of a man type. So because of the increased level of male hormones, the female is actually getting converted into male slowly by all these features, by the hair growth, by the body structure, by the voice. And all these features are very depressing for a female, and all this causes a lot of psychological stress to the girl and the women. So many times women do not face any of these symptoms but come to our OPD with the complaint of infertility. They are not able to conceive. So around 40 to 50% of PCOS patients suffer from infertility, which is again a very important symptom of this disease. PCOS hampers the ovulation. It hampers the production of eggs and hence the conception of the baby. So again, infertility is one of the most common symptoms of PCOS. So conception is a task for patients with PCOS, but it is not impossible to conceive. The patients who are able to conceive will definitely land up into a high-risk pregnancy. Such patients can land up into gestational diabetes mellitus, which means they can suffer from high blood sugars in pregnancy. Along with that, high blood pressure in pregnancy, which is called gestational hypertension. So these patients are also at a high risk of multiple abortions. So whenever you conceive, you need to see your doctor so that you prevent from getting a miscarriage or even developing all these kind of gestational problems in your future pregnancy. One of the important symptoms of a lady with PCOS is decreased sleep quality. Decreased sleep quality is again a very important symptom because it leads to adrenal fatigue and hence the tiredness the entire day. The lady doesn't feel fresh at all when she gets up. Not just this, but the lady also suffers from problem of snoring and hence sleep apnea. So what is sleep apnea? Sleep apnea, in sleep apnea, the patient suffers from lack of oxygen or hypoxia, because of which the patient gets up suddenly at night, craving for oxygen. Again, the sleep apnea is a very important symptom because its future implications are very serious. Sleep apnea can lead to cardiovascular or heart diseases in future. Decreased sleep quality, as I've already said, creates adrenal fatigue. So this fatigue can cause a lot of tiredness, headache, and even high blood pressure in the patient. So patients with PCOS suffer from a lot of psychological problem and a negative body image. Do you know why? Because of the increased level of male hormones, these ladies suffer from a lot of unwanted hair, especially on the face, lot of pimples, hair fall. Negative body image is one of the very important factors that they suffer from. So the first point of contact with the medical facility is often a psychologist and not a gynecologist. So what I'm trying to say is that PCOS is not just a problem of ovary or periods. It affects your entire body. So PCOS leads to a lot of mood swings, anxiety, depression, and even sometimes suicidal tendencies. So now let's understand the reason for PCOS. So number one are the genetic causes. Now you may argue that your mothers and your grandmother never suffered from such a disease. So my interpretation of such an argument is that these genes are always present in your DNA structure. But genes always need a very favorable environment to express themselves. With the changing lifestyle, with the increased use of laptops, screens, with increased sedentary lifestyle that we all live nowadays, with the increased number of processed foods that we take in every day, these genes are getting favorable environment to express themselves. And therefore, the PCOS problem is now becoming very common in young ladies, in reproductive age group lady, and even in postmenopausal ladies. So the next important reason for PCOS is your poor lifestyle. So with the increased use of screens, with the increased use of a lot of processed foods, increased corporate lifestyle, such kind of lifestyle actually makes way for PCOS. Processed foods, in fact, use of lot of plastics also have been shown to increase the incidence of PCOS. So the third and the most important reason for PCOS is increased insulin resistance. So what is insulin? Insulin is a hormone which is secreted from pancreas, and its main role is the consumption of glucose in the body. So what happens in PCOS is that the insulin is not able to function properly. its receptors are not able to function properly. So the amount of glucose keeps on increasing in the body, in your bloodstreams. So when the insulin is not able to utilize this glucose, the body perceives as if the body is not getting the glucose, and it gets more and more hungry, and the craving starts, especially for the sugars, for the whites. And because of this, when you take a lot of sugars, you take a lot of whites, again this increases the insulin production in the body, and this creates a vicious cycle in the body. So whenever we test the blood for insulin, the insulin levels are actually very much increased, but they are not able to function well. They are not able to utilize the glucose present in your bloodstream. Now this again leads to increased blood sugars in your blood profile. Also, because of the increased insulin, the ovaries, they also increase in size, they increase in volume, which is easily seen on ultrasound, and this is again a very important diagnostic feature of PCOS. Along with this, because of the increased insulin, it increases the amount of male hormone in a female. It increases the level of testosterone, it increases the level of androgen. So because of all this, the lot of symptoms of PCOS are because of increased insulin that is present in our bloodstream. So this is one of the most important reasons for PCOS. We will be discussing in detail about the insulin resistance and how insulin works, and how the insulin increased in the body will cause all these symptoms will be discussed later on in our series. So again, a very important reason for PCOS is chronic inflammatory state in the body. So what is inflammatory state? Inflammatory state is equivalent to the stressful state. Whenever you are in stress, whether mentally or physically, the body creates a low level of inflammation in the body. By inflammation, I mean the body creates a lot of bad hormones, lot of reactive radicals that actually harm the body in order to maintain the system of the body. So whenever you are watching lot of movies, you are getting up late in night, you are eating a lot of processed food, body takes all this as a stressful situation, because of which the inflammation increases. And because of this inflammation, cortisol or the steroid hormones increase. Now these hormones are responsible for a lot of body fat in your body, especially the belly fat, your face fat, the chin fat is because of the steroid hormones. So because of the increased level of steroid hormones and decreased level of melatonin, your sleep quality decreases, you face a lot of adrenal fatigue, you feel tired the entire day, and also you face a lot of mood swings and depression and anxiety. So here we have discussed about what is PCOS, what are the causes of PCOS, and what are the symptoms of PCOS. Now it is very important that you diagnose this disease of PCOS very vigilantly. Why? Because its future implications are very serious, as I have already discussed. These patients often land into diabetes or increased blood pressure, psychological issues, and even endometrial cancer. So in this video, we have discussed what is PCOS, about the causes of PCOS, and the symptoms of PCOS. So further in this series, we will be discussing about the right way of diagnosis, about various lifestyle choices, about the treatment options, and also about the various kind of exercises that can be very helpful in the treatment of PCOS. So stay tuned with our channel.